But we have a question from Associated Press. Please go ahead. It looks like we don't have that question from Associated. Oh, there you are. Please go ahead.
Hi, this is Jamie from AP. Just wanted to ask you very quickly, Dr. Tedros, about the tweeting that you did yesterday. You were pretty praiseworthy of President Trump's efforts, and I'm just wondering. You said he's doing a great job, and I'm just wondering, that President Trump has, from the beginning, sort of minimized the importance of this at the very start, and then is now talking about churches that might be packed in the United States come Easter time. How concerned are you about some of the decisions that he's making, or do you really think he's doing a great job across the board? Thanks.
Yeah, I stand by what I said. As you know, one of the recommendations from WHO is the whole of government approach involving all sectors. And the principal, which is the head of state, taking responsibility and leading the whole response. And that's exactly what he's doing, and which we appreciate, because fighting this pandemic needs political commitment, and commitment at the highest level possible. And the president's commitment, you have already seen it, and the world have seen it. And that kind of leadership is very, very important, the whole of government approach, to mobilize all sectors and stop or suppress the pandemic. So I know he's doing all he can, but not only the whole of government approach, but the other, like expanding testing, and also the other recommendations we're making are also in play, and he takes that seriously, and that's what we see. And I had a conversation, I had a chance to discuss with him, and that's what he said, and he's doing. So I believe that kind of political commitment and political leadership can bring change, or can stop this pandemic.
I just supplement again, just to say, earlier today we spoke with Bob Redfield and with Tony Fauci, and we're very impressed to see the work that their institutions and other institutions, technical, fabulous public health research and other institutions are doing in the United States, but also supporting on the international front. We've had the benefit of having had secondees from CDC Atlanta present here in Geneva for more than a year and a half now, between Ebola and between COVID-19. Our colleagues at NIH are the ones who have innovated and have managed, working with others in the United States, to start the first trials of vaccine. NIH and ourselves are working very closely together on trials of existing therapeutics. The FDA have been exceptionally helpful on the regulatory side, and are working with us on everything from animal models for vaccine development and much more. We rely heavily on the scientific innovation and public health prowess of the United States, and very much appreciate the way in which Dr. Fauci broke down the issue yesterday when he spoke about the data. He spoke about getting down to the state and the county level and working through the problem and working through the issues. And again, we remain impressed by the work being done at state level by state and county public health departments. Now is the time to support them. Now is the time that health workers all over the world need to get the support to do the jobs they need to do. They are our heroes, and we are all there to support them.
Thank you very much, Dr. Ryan. And on that inspiring note, we'll close this press conference. Thank you very much, everybody, for attending. We will send the audio, we will send the transcript as usual. We'll also send you information about the WHO Film Festival. Thank you again, and we'll reconvene on Friday.
Thank you. Thank you, and see you on Friday.